Now at 6, Governor Cuomo's dire call for action. He puts the pandemic in the starkest terms yet. He pleads for more equipment and says any delay will cost lives.
You pick the 26,000 people who are going to die because you only sent 400 ventilators.
The major changes being made to subway service and the drastic new action New Jersey is taking, releasing jail inmates and opening a mega testing center. Good evening. I'm Natalie Pascarella.
And I'm Chuck Scarborough, reporting from my home in Connecticut. And right now, communities across the tri-state area are intensifying their battle against the novel coronavirus.
That's right, Chuck. Governor Cuomo revealing that the virus is spreading faster than expected. He says we could hit the peak within 2 to 3 weeks. He also says that the state now needs 140,000 beds. That's almost triple the number of beds in the state now. And as you heard moments ago, the MTA is cutting back on service on subways, buses, and the LIRR and Metro North. There are more than 25,000 cases in New York State, more than half of all cases in the U.S. We have 183 deaths here. New Jersey has more than 3,600 cases, and as you see, 44 deaths. Connecticut just reported more than 600 cases with 12 deaths. We have team coverage for you tonight, starting with News 4's Andrew Siff with Governor Cuomo's urgent plea for action tonight. Andrew.
Yes, Natalie, I was with the governor here at the Javits Center earlier today. This convention hall, 2 million square feet, being converted into a makeshift hospital with up to 2,000 beds for non-coronavirus patients. That is supposed to ease the burden somewhat on New York City hospitals, where there's an urgent need for surgical gowns and, more importantly, ventilators, which have been arriving in the city, but not fast enough. New ventilators arrived today in Brooklyn.
We're very happy that this shipment has arrived.
Too little too late for officials grappling with a doubling of coronavirus cases every 3 days.
April will unquestionably be worse than March. And right now, my fear is that May could be worse than April.
The city has tried to slow the pandemic by eliminating crowds. New signs at parks warn fields are closed to group play.
No one's playing basketball. No one's playing soccer.
But the mayor today said more limits are likely on outdoor life.
If by the end of Saturday it is not sufficiently clear that New Yorkers are following these new rules, at that point we'll be prepared to shut down playgrounds for the foreseeable future.
Meanwhile, the economic impact of a mostly empty city, dramatic. Even though some LIRR riders complain rush hour trains still don't allow social distancing, subway ridership is down more than 75%. The MTA chairman late today announcing reduced service starts tomorrow.
For now, we will focus on the MTA Essential Service Plan, so essential workers can continue delivering for New York.
The governor said boosting the economy depends on a new test for healthy New Yorkers who've developed immunity to coronavirus. How soon could a test for that coronavirus antibody be ready and be used on a mass scale?
They're working on it now. You don't have a hard answer now, Andrew. They're working on it now. They're developing it.
Meanwhile, even with thousands of businesses closed and tens of thousands of people out of work, the governor said it's all in the name of saving lives.
It's about my mother. It's about your mother.
Mayor de Blasio said late today that by Thursday, he may have specifics on a street closure plan, up to 2 streets in each borough. The idea is to give pedestrians room to go outside in the better weather and still observe social distancing. We're live on the West Side. Andrew Siff, News 4 New York.
All right, Andrew, thank you. Well, tonight, students and teachers are mourning the death of a Brooklyn principal who died from coronavirus complications. 36-year-old Dezanne Romaine led the Brooklyn Democracy Academy in Brownsville. School's chancellor, Richard Carranza, called Romaine's death painful. He said the school community is experiencing a deep sense of confusion, uncertainty, and sadness. It is not clear if Romaine suffered any underlying health issues. Well, the NYPD is starting to feel the full impact of the coronavirus on its force. 173 members have tested positive, and thousands of members are now out sick. Chief investigative reporter Jonathan Dienst reveals how this is affecting the department as it's trying to enforce social distancing.
Not everyone singing the same tune when it comes to social distancing. So the NYPD now sending in patrols to parks to help break up games and gatherings.
You're going to hear radio cars driving through the parks over their PA system announcing, listen, keep your social distances, stay 6 feet apart.
In Seton Falls Park in the Bronx, the chief of patrol says these players got his message. The NYPD now moving 500 administrative officers to patrol to help with the effort. The extra bodies will be needed next week because so many officers are now calling in sick. More than 3,000 officers and civilians, nearly 7% of the NYPD, has called out sick, with 173 now testing positive for the virus.
You know, as much as we talk social distancing, as a cop, that's almost impossible to do. We're interacting with people on a regular basis, a lot of times in close quarters. So men and women are getting sick.
The NYPD not alone. In New Rochelle, a town which has suffered an outbreak, police report 5 officers there have tested positive. And in Westport, Connecticut, where dozens of residents have fallen ill, no positive test yet among police staff there, although 9 officers, or 14%, have called out sick since the outbreak began. Other departments also using patrol officers to help with social distancing. These police dash cam videos from South Brunswick show officers checking playgrounds where, despite the nice weather, residents cooperating by keeping apart. In New Jersey, state police this afternoon tell us that 4 of their troopers have now contracted the virus, along with 2 members at their police academy. In Central Park, Jonathan Dienst, News 4.
Well, 2 big headlines coming out of New Jersey tonight in the fight against the coronavirus. First of all, hundreds of inmates are being let out of county jails there. And second of all, the state is helping to evacuate a nursing home to protect the most vulnerable. News 4's Brian Thompson is standing by in Newark with that story for us. Brian.
Yeah, Chuck, and that nursing home development late this afternoon caught all of us by surprise. But the state health commissioner stating the obvious, that the people who are in assisted living, the elderly with underlying conditions, are certainly the most vulnerable. Of the 44 deaths that we have recorded so far, that we know about in New Jersey anyway, 9 have been living in assisted living, and 1 in Woodbridge. 1 nursing home there is expected to shut down. A death here at St. Joe's Assisted Living in Woodbridge last week. Since then, 11 employees went home sick with flu-like illness and multiple sick residents, some already positive COVID-19. State Health Commissioner Judy Persicilli.
The sisters were working around the clock to take care of almost 90 residents. I don't know how many were there, but when they called us, I can tell you that it was an extremely stressful situation.
The healthy residents already transferred elsewhere. The health commissioner says St. Joe's will likely shut down permanently. At his afternoon news conference, Governor Murphy scolded people using the pandemic to lash out at others. Murphy highlighting an incident at this Wegmans in Manalapan, a customer arguing with an employee. The governor explaining.
Coughed on the woman and told her after doing so that he had coronavirus.
The fear is palpable. The National Guard at the scene of the Holmdel testing facility. Secaucus now open. And like Holmdel, people turned away in Paramus after just a half hour or so of being open. Bergen County now working to start up appointment-only testing for its residents and first responders. Fear of a jail spread is why the state agreed to release hundreds of inmates in county jails across New Jersey. Inmates and staff in at least 3 jails, Bergen, Essex, and Morris, now testing positive. They'll still likely have to serve their time when the outbreak ends, but for now...
We're not coming out to the outside world, but they were still bringing people in, so we don't know.
Meanwhile, bus and rail service will continue in New Jersey. It's considered essential, but ferry service by private company New York Waterway can't afford to run empty boats, and along with its buses is in dry dock, except for a literal handful of routes. Now, moments ago, you heard the sick roll for the New York City Police Department in Newark. The police department here is reporting 3 officers have tested positive, 6 firefighters testing positive, and many more on both categories out ill. Live in Newark, Brian Thompson, News 4 New York.
All right, Brian, thank you very much. And the 2020 Summer Olympics have become the latest casualty of the coronavirus, the Olympics in Tokyo. The Olympics are going to be postponed until next year. Now, this is the first time the Olympics have been postponed since World War II. Bruce Beck is standing by in the newsroom right now. And Bruce, for these athletes who have trained for the last 4 years, this has to be a terrible disappointment.
Very much so, Chuck. The Olympic dreams of over 11,000 athletes will have to wait until next year. Today, the 2020 Tokyo Games were officially postponed until 2021. Pressure to delay the Olympics from nations and athletes alike mounted in the last 48 hours. Last night, the U.S. Olympic Committee urged the IOC for a postponement to ensure fair and safe conditions for the competition. And today, the inevitable happened. It's unclear when exactly the games will begin, but it will be no later than next summer. Despite the postponement, the Olympic flame will continue to be displayed in Japan. Here's NBC Sports Olympics host Mike Tirico on the impact this has on thousands of athletes.
This is a once-in-a-lifetime thing for so many athletes. So for them, will they be able to repeat their readiness in 2021 as they were trying to get ready for July of 2020?
A misconception is that, you're an Olympic athlete. Well, it doesn't mean that, you're making tons and tons of money. So yes, a lot of us put life on hold, and regular life means regular jobs and family and such like that. So a lot of us are going to have to put that on hold again and figure out how to make ends meet for another 12 months.
So Olympians around the globe will have to wait until next year to compete. That same sentiment is also being felt by a local star, Mets pitcher Noah Syndergaard. The man known as Thor is set to undergo Tommy John surgery. The 27-year-old right-hander began experiencing elbow discomfort shortly before spring training was suspended. Now an MRI has revealed a torn ulnar collateral ligament. Syndergaard, one of the hardest throwers in all of baseball, will be sidelined until April of 2021 at the very earliest. Noah had an up-and-down season a year ago, going 10-8 with a 4.28 ERA. So even when the Mets aren't playing, the team still has some tough news to deliver. Who knows when we will see a baseball game this year in America? If and when it does happen, Noah Syndergaard will not be on the mound for the Mets. Live in the newsroom, I'm Bruce Beck, News 4 New York. Natalie, back to you.
All right, Bruce, thanks for keeping us posted there. Well, normally a sea of first responders greets one of their own when they leave a hospital, but when a member has coronavirus, the welcome home looks a little bit different. You see some of the elbow bumps there. Today, the first known FDNY EMT to be diagnosed with COVID-19 was released. He's feeling better, but his story is serving as a warning for all FDNY workers. And News 4's John Chandler is live with the department's urgent plea tonight. John.
Well, Natalie, watching that EMT worker walking out of Coney Island Hospital today was a moment of hope that we all needed to see, but it also underscores the urgent, matter of fact, desperate need for personal protective equipment. Joseph Castelli walks out of Coney Island Hospital and into recovery. He's greeted with elbow taps, the first EMT to test positive for COVID-19. Released and relieved.
Coney Island Hospital did an excellent job. Excellent. They saved my life.
But to keep saving lives, Joseph says healthcare workers desperately need help.
But we need more testing.
And they also need more protective equipment like N95 masks. Oren Barzilay is the president of the EMTs union and underscores the demand for PPEs.
The department has informed us that because they're running out of their stockpile, we may have to reuse the ones that we have.
51 in the FDNY, including EMTs, have tested positive, and they expect more will without proper gear.
A 30-year-old young lady in intensive care unit, it's mind-boggling that they're not implementing higher safety procedures.
The FDNY says not every response requires an N95 mask, but adds every form of protection is now on the table to keep its full workforce safe as this crisis spirals in real time. It has enough PPEs for days, even weeks, but not months.
All we can hope for is that the pleas from the governor and the mayor have been heard in Washington.
As Joseph walks into recovery, he aims to return soon. He's seen himself how urgent the need is.
You know, this is the work we do. It's dangerous, and we're highly underpaid.
We are the front line. If you're going to lose the front line, who is going to take care of all these sick people?
Now, the local 2507 is accepting donations for any masks or PPEs that you may have. Meanwhile, the FDNY says it is pushing the Department of Health to try and get more gear on the way to help its workers. We're live at the Coney Island Hospital. I'm John Chandler, News 4 New York.